I'm Dr. Igor Koralnik. I'm professor of neurology and the chief of the section on neuro-infectious diseases and global neurology at the Northwestern University Feinberg School of Medicine, and I'm here to talk about the neurologic complication of COVID-19. COVID-19 is caused by the coronavirus SARS-CoV-2, and initially it was felt to be only a disease of the respiratory system, including flu-like symptoms, sore throat, fever, and infection of the lungs. We know now that COVID-19 can also cause a multi-systems disease, including the kidney, the digestive systems, the heart, and also the entire nervous system. COVID-19 can affect both the central and peripheral nervous system, and most frequent neurologic manifestations include headache, dizziness, alteration of consciousness. The disease can also cause disorder of smell and taste, muscle pain, stroke, and seizures, as well as weakness. Patients who have severe lung disease requiring intubation and mechanical ventilation are at higher risk of developing certain neurologic manifestations of COVID-19. Those patients often have multi-organ failure and a high level of inflammation in their body, which is called the cytokine storm, as well as coagulopathy. We need to be aware that this is an RNA virus causing the disease, and those viruses mutate, and therefore it is possible that different strains of the virus will evolve and may affect people with different genetic background in various ways that we haven't seen before. So that's why at Northwestern Medicine we are committed to continue to study those manifestations for the better care of our patients. First, we need to find out if those common neurologic manifestations are actually caused by the virus or not, and if some specific tests need to be performed in order to ascertain their diagnosis. There is no specific treatment for the virus itself, but patients presenting with headache can be treated with headache medication. Those with stroke and seizures will have specific medication to prevent them to have further neurologic events. And those patients with weakness may also have specific treatment prescribed to them. At a time where many areas in the US unfortunately are seeing a second wave of infection, I think it is very important to follow the guidelines of the CDC, including social distancing, wearing masks, and if people are found to be infected, isolation as well as contact tracing. At Northwestern Medicine, we are studying the many neurologic manifestations of COVID-19. The first study is a retrospective analysis of the first 500 patients who are hospitalized with COVID-19 to try to understand the prevalence of neurologic manifestation as well as their risk factors. The second study is occurring in my outpatient Neuro COVID Clinic, where we want to understand if those manifestations are transient, permanent, how to better manage them, and how to treat them. Northwestern Medicine is all about the relentless pursuit of better treatment, and we have to realize that we are all in it together, and we will work with you and your patients to try to find the better way of treat the many neurologic manifestations of COVID-19.